Bismillah ar-Rahman ar-Rahim, Dr. Alsayouf, consultant pediatric neurologist, American boarded. We will talk today about the refractory epilepsy. Refractory epilepsy in a simple lay language is an epilepsy that does not respond to medication, classically to medication, and mainly, three medication. So 75% of the seizures are well controlled by three medication. And when we say well controlled on three medication and the epilepsy is refractory, if the patient is not responding to three medication that are well chosen for the type of the seizure and used at appropriate dosage, which means if a patient have a partial onset seizure and they have used Trileptal, for example, and pushed up the dose and no improvement, then Keppra, pushed up the dose, no improvement, Verapamil, pushed up the dose, or Tobamax or Lamictal, and at appropriate dose and no improvement, most likely, the chance for the patient to improve on a further medication is basically around 5% per year. Then at that time we call this patient is refractory epilepsy. Now the refractory epilepsy depends if it's a generalized or partial. If it's a partial onset seizure, of course the most important point, especially if you have a focus for the seizure, is to consider the patient for epilepsy surgery. طبعا we need to let you know that epilepsy surgery, it should be done in a hospital where there's an epilepsy team. What do I mean by epilepsy team? There should be a pediatric neurologist who is trained to read the EEG and trained to read and treat a patient with a team of a neurosurgeon and pediatric epileptologist. There should be also a pediatric neurosurgeon who is trained to do epilepsy surgery. Not every pediatric neurosurgeon will be able to do epilepsy surgery. This is a special training that requires 1 to 2 extra years of training for the pediatric neurologist or the pediatric epileptologist to be able to work as a part of a pediatric epilepsy surgery team. It has to happen in an area where is a video EEG monitoring team, and also trained ER team, trained neuroradiologists who can read the MRI very well. That's what we call a pediatric epilepsy team. So when I refer the patient, I refer him to the pediatric epileptologist who decide what kind of seizure, try to find the focus by doing advanced studies, and discuss it with the pediatric epilepsy surgeon as a team, and the pediatric neuroradiologist who is trained to read MRI of these kids, or the special study, neuroradiological study of these kids, to be able to decide what to do and what kind of surgery should be good. Now, if there is no focus and if the patient does not have any focus that can be treated surgically, then at that time you are left with a few options. Either you use the diet, ketogenic diet, or modified Atkins diets, or you can what we call vagal nerve stimulator, which is a small battery you put under the skin and you hook it up to the vagus nerve to give a signal to the brain, so it can suppress epilepsy focus, and this can abort or cure the seizure in 7%, and 50% of the kids will improve more than 50% in their epilepsy. Now, if you have no epilepsy surgery, no hospital with a team that can use a diet for treatment of epilepsy, and you don't have a vagus nerve stimulator, then you are left with trying medications and combining medication, and try your best to send the patient abroad for epilepsy surgery if you can. If the patient has an epilepsy syndrome, or if the patient has generalized epilepsy that's refractory, then at that time your option may be vagus nerve stimulator, diet, or sometime they use a medication that have never used, and it is very unlikely to be used except in highly specialized epilepsy unit like filbamate, because of its potential side effect. We only go to these steps: diet, vagus nerve stimulator, epilepsy surgery, if the patient is not responding to medication. A lot of the time the family come to me and tell me, Dr. Hamza, my patient is well controlled in trileptal from the first 1 month. Oh, can we treat him with diet? I tell him I tell them diet is for refractory epilepsy. I hope this is also a very helpful pieces of information, and please wait for us for the next epilepsy episode. And I think we are left with 3 more episodes, and we will conclude the series. Thank you and have a good day.